Daniel, thanks for being here. What would be your recommendation regarding when you're like a healthcare startup? What do you need in order to, well, be successful in the healthcare market, which is a complicated market?
I think what you need as a healthcare startup is a really good, powerful need to go after and we call those pain points often. What is a problem you're having as a physician, as a patient, as a nurse, or a caregiver, and really understanding that need in detail. Some folks build a technology and try and find a solution for that technology to use. I think the most important to start with is really having a compelling need, understanding that from all the angles, because you might build a solution that might not work based on the fact that the nurse won't like it, or the hospital administrator won't pay for it, or there's some regulatory issue. So understanding all the angles, and then innovating a solution that I like to say is a convergent solution. The best solutions today take two or more technologies and put them together in smart ways. It might be sensors or big data, robotics or 3D printing, or new ways of blending these technologies together to address a problem in new ways. So I think the key thing is a key unmet need and then applying new thinking to that. And I like to think exponentially, not just where technology is going to be today. If you have a wearable like this one, it's going to have a lot more capability in 2 and 3 or 5 years. How do you build a platform that's going to ride those waves of technology, have a minimal viable product to start with, but one that can grow using the faster, cheaper, smaller computation, sensors, and beyond?
Okay. Healthcare is a harsh regulatory environment, so it's really tough for startups to get into the market because the barriers are very high. So what would be your recommendation? How should a startup overcome this, or what should be your mental attitude to get over these rules and barriers?
So the regulatory environment is obviously important. We need to keep patients safe and develop new tools, technologies, drugs, apps that are actually effective and safe. At the same time, the regulators are not often thinking in a forward manner. They're sometimes back 20 years ago. But when you're an entrepreneur, our job is also to push the barriers and not just be boxed in by today's regulatory environment. Sometimes the regulatory environment might be different in the US or Asia or Africa. And I think it's part of the job of the entrepreneur also to push the regulatory world. So not to be completely limited, to understand it, but also say, how can we enter it where it is now and help guide that environment into the future? Like, how do you regulate an app? It won't be an app that regulates your exercise. That's one thing. If it's one that regulates your blood sugar and uses insulin changes, it's another kind of regulatory environment. So my view is understand where you live in your environment, but also help drive smart innovations for the regulators. There's new ways to do clinical trials. There are new ways to engage patients. There's new ways to make consumer versions that aren't quite medical as a starting point to learn and to grow, and to also use other regulatory parts of the world that might be more innovation friendly.
Doctors are under enormous stress to keep up with the developments happening out there. There's 1,000 things happening like parallel in the market. What should a doctor do in order to keep, well, basically up to date so that he doesn't miss out on the important development in medicine?
Well, the poor doctor today is often overwhelmed by more patients, more demands. Just because there's a new app or service or wearable doesn't mean that the doctor or the nursing team has time to log into a new application, etc. So as an innovator, first of all, when you're thinking about the clinic, think about how you can get that part of the workflow of the doctor so they can actually use it. If it's an app that helps track blood pressure, for example, ideally that flows into their electronic medical record or can alert the medical team when someone's off. As a doctor or nurse or anybody else who's a healthcare professional, we want to do better care for our patients. Don't wait for some of these things to arrive. Seek them out. It could be prescribing a wearable device to your patient who has heart failure or asthma and say, I want to watch you walking more and more every day. It may be, instead of giving someone a pamphlet about diet and exercise, prescribing them an app that helps them track their food intake. And do some simple things that can help your patients and enable them to be empowered. The old model was you go to the doctor, they're the god, they tell you what to do. The new model is the patient is the CEO of their own health. And I think if we look at that sort of model where we're engaging the consumer, the patient, to be empowered, to be part of the healthcare team, that will help the entire system give better outcomes, better prevention, better therapeutics, and better care at lower costs.
Oh, cool. So what is your bet? What will be the most important development and change in medicine through the next 5 years, let's say?
I think we're on this exponential pace of new sensors, new data, big data, for example. And I think what's going to happen in the next 5 years is we're going to start connecting the dots. No one wants to log into 5 different apps and wearables and sensors. We're going to start to see what I like to call the sort of check engine light for the body. These will become commodities. What you wear on your wrist won't matter, but how you take the data and put it together and give you insights, early prevention warnings, or managing a disease in smarter ways, a bit of a GPS kind of guidance for your healthcare. I think that's going to be what's happening in the next few years as we start to integrate the data. The Internet of Things coming to the Internet of the body, coming to the Internet of healthcare. And if we can be smart about connecting the dots while we're smart about privacy and protecting individuals' data, allowing it to be shared when patients and others want to be, so we can crowdsource the information. Just like when we drive with Google Maps, we're sharing our speed and location, but we get the data back about the traffic. That kind of sensibility can come to healthcare, and I think that's going to be one of the biggest elements of healthcare innovation in the next few years, layering with artificial intelligence and machine learning to engage and empower the patient, as well as the healthcare system, pharma, device companies, and beyond.
Great, thanks.